Hello, assalamu alaikum. Welcome to our language clinic channel. We will going to talk on left ventricular hypertrophy, that is a part of our human heart. We will talk about the overview of left ventricular hypertrophy, and then we will talk about the complications, the preventions, and the medicine and diagnosis in details on this. So if you want to know more about left ventricular heart hypertrophy or valvular heart disease, you should watch every moment of this video. Let's talk about the overview or introduction of left ventricular hypertrophy. Actually, what is left ventricular hypertrophy? Left ventricular hypertrophy is thickening of the walls of the lower left heart chamber. The lower heart chamber is called the left ventricle. The left ventricle is the heart's main pumping chamber. During left ventricular hypertrophy, the thickened heart wall can become stiff. Blood pressure in the heart increases. The changes make it harder for the heart to effectively pump blood. Eventually, the heart may fail to pump with as much force as needed. Uncontrolled high blood pressure is the most common cause of left ventricular hypertrophy. Complications include irregular heart rhythms called arrhythmias and heart failure. Treatment of left ventricular hypertrophy depends on the cause. Treatment may include medications or surgery. Let's talk about the symptoms of left ventricular hypertrophy. Left ventricular hypertrophy usually develops gradually, slowly, over time. Some people do not have symptoms, especially during the early stages of the condition. Left ventricular hypertrophy itself does not cause symptoms, but symptoms may occur as the strain on the heart worsens. They may include, number one, shortness of breath, especially while lying down. Number two, swelling of the legs. Number three, chest pain, often when exercising. Number four, sensation of rapid, fluttering or pounding heartbeats called palpitations. Number five, fainting or feeling of lightheadedness. Now the question is when you should see your doctor. Seek emergency care if you feel chest pain that lasts for more than a few minutes, if you have severe difficulty breathing, if you have severe lightheadedness or lose consciousness or you become unconscious, if you have a sudden severe headache, difficulty speaking, or weakness on one side of your body, if you have mild shortness of breath or other symptoms such as palpitations, see your healthcare professional. If you have high blood pressure or another condition that increases the risk of left ventricular hypertrophy, your healthcare team is likely to recommend regular health checkups to check your heart. So this is the situation when you should see your doctor. Now let's talk about what are the causes of left ventricular hypertrophy or what causes left ventricular hypertrophy. Anything that puts stress or pressure on the heart's lower left chamber can cause left ventricular hypertrophy. The left lower chamber is called the left ventricle. As the strain on the lower left chamber increases, the muscle tissue in the chamber wall thickens. It thickens. Sometimes the size of the heart chamber itself also increases. Left ventricular hypertrophy also may be caused by gene changes that affect the heart muscles structure. Things that can cause the heart to work harder and may possibly lead to left ventricular hypertrophy include number 1, high blood pressure. Also called hypertension, this is the most common cause of left ventricular hypertrophy. Long-term high blood pressure strains the left side of the heart, causing it to grow bigger. Treating high blood pressure can help reduce left ventricular hypertrophy symptoms and may even reverse it. Number 2, narrowing of the aortic valve. The aortic valve is between the lower heart chamber and the body's main artery called the aorta. Narrowing of the valve is called aortic stenosis. When the valve is narrowed, the heart muscle must work harder to pump blood into the aorta or the vein. Number 3, intensive athletic training. Intense, long-term strength and endurance training causes changes in the heart. The changes help the heart handle the extra physical workload, but the changes can make the heart muscle grow larger. Sometimes this is called athlete's heart or athletic heart syndrome. It's unclear whether the increased heart size in athletes can lead to stiffening of the heart muscle and disease. Certain conditions passed through families, called genetic conditions, can make the heart thicker. They include number 1, hypertrophic cardiomyopathy. This condition is caused by changes in genes that cause the heart muscle to thicken. The thickening makes it harder for the heart to pump blood. It can occur even without high blood pressure. People with one parent with hypertrophic cardiomyopathy have a 50% chance of having the change gene that causes the disease. Number 2, amyloidosis. Proteins build up around the organs, including the heart. The collection of proteins interferes with how the organs work. When the condition is passed down through families, it is called familial amyloidosis. It also may affect the nerves and kidneys. Now let's talk about the risk factors. What are the risk factors for which you can be vulnerable or susceptible to left ventricular hypertrophy? Risk factors are things that increase the risk of left ventricular hypertrophy include number 1, age. Left ventricular hypertrophy is more common in older people. So is high blood pressure, which can cause heart muscle thickening. Number 2, weight. Being overweight increases the risk of high blood pressure and left ventricular hypertrophy. Family history. Number 3. Changes in genes passed down through families may lead to left ventricular hypertrophy. Number 4, diabetes. Having diabetes increases the risk of left ventricular hypertrophy. Number 5, female gender. Women with high blood pressure are more likely to get the condition than are men with similar blood pressure measurements. So now let's talk about the complications, the more complexities and complications that left ventricular hypertrophy can cause. Left ventricular hypertrophy changes the structure of the heart. And how the heart works. The thickened left ventricle becomes weak and stiff. This prevents the lower heart chamber from filling properly with blood. As a result, blood pressure in the heart increases. Complications of left ventricular hypertrophy include number 1, heart failure. Number 2, irregular heart rhythms called arrhythmias. Number 3, too little oxygen to the heart called ischemic heart disease. Number 4, sudden unexpected loss of heart function, breathing and consciousness called sudden cardiac arrest. Now let's talk about the prevention of left ventricular hypertrophy, or how we can prevent left ventricular hypertrophy. The same healthy lifestyle changes recommended to treat high blood pressure also help prevent left ventricular hypertrophy. Try these tips. Number 1, do not smoke. Number 2, eat healthy foods. Number 3, use less salt. Number 4, limit or avoid alcohol. Number 5, get regular exercise. Number 6, maintain a healthy weight. Number 7, get 7 to 9 hours of sleep daily. Number 8, manage stress, any kind of mental, psychological, or any kind of pressure. Uncontrolled high blood pressure increases the risk of left ventricular hypertrophy. Get your blood pressure checked at least every 2 years if you are 18 and older. If you have high risk factors, if you have risk factors for heart disease or are over age 40, you may need more frequent checks. Ask your healthcare team what blood pressure reading is best for you. Your healthcare professional may recommend checking your blood pressure at home. Home blood pressure monitors are available at local stores and pharmacies. Now let's talk about how to diagnose that this is left ventricular hypertrophy, and let's talk about the treatment of left ventricular hypertrophy. To diagnose left ventricular hypertrophy, a healthcare professional does a physical exam and asks questions about your symptoms and family's health history. The care professional checks your blood pressure and listens to your heart with a device called a stethoscope. Lub-dub, if it is making a lub-dub sound or tic-tac sound. There are also some tests used to diagnose left ventricular hypertrophy may include: number 1, lab test. Blood and urine test may be done to check for conditions that affect heart health. Test may be done to check blood sugar, cholesterol levels, and liver and kidney function. Number 2, electrocardiogram or ECG or EKG, also called ECG or EKG. This quick and painless test measures the electrical activity of the heart. During an ECG, sensors called electrodes are attached to the chest and sometimes to the arms and legs. Wires connect the sensors to a machine which displays or prints results. An ECG can show how well the heart is beating. Your care provider can look for signal patterns that suggest thickened heart muscle tissue. Number 3, echocardiogram or simply echo. An echocardiogram uses sound waves to create pictures of the heart in motion. This test shows blood flow through the heart and the heart valves. It can show thickened heart muscle tissue and heart valve problems related to left ventricular hypertrophy. Number 4, heart MRI. This test, also called a cardiac MRI, uses magnetic fields and radio waves to create detailed images of the heart. So these are the tests you have to do for diagnosing left ventricular hypertrophy, or your healthcare provider will instruct you to do this test. Okay, let's talk about if you have already had left ventricular hypertrophy, or if you are really suffering from left ventricular hypertrophy, what are the treatment plan for you? Treatment for left ventricular hypertrophy depends on the cause. It may include medicines, catheter procedures, or surgery. It's important to manage conditions such as high blood pressure and sleep apnea, which can cause blood pressure to be higher. Medications. Number 1. Medicines are used to treat symptoms and prevent complications of left ventricular hypertrophy. Blood pressure medicines may help reduce or prevent thickening of the heart muscle. The type of medicine used depends on the cause of left ventricular hypertrophy. Medicines that might be used to treat left ventricular hypertrophy or the conditions that cause it include number one, ACE inhibitors, or it is called angiotensin converting enzyme inhibitors. These medicines widen blood vessels to lower blood pressure. They can improve blood flow and increase and decrease the strain, the pressure on the heart. Side effects include persistent cough. Number two, angiotensin 2 receptor blockers, also called ARBs. These medicines have benefits similar to ACE inhibitors but don't cause a persistent cough. Number three medicine is beta blockers. These medicines help control the heart rate. They also help the heart move blood with less force. Number four, calcium channel blockers. These medicines relax the heart muscle and widen blood vessels. This reduces blood pressure. Number five, water pills, also called diuretics. These medicines reduce the amount of fluid in the body, lowering blood pressure. Other treatment plan is surgery or other procedures. Left ventricular hypertrophy that is caused by aortic valve stenosis or narrowing might require a catheter procedure or surgery to repair or replace the valve. Surgery or other procedures may be needed to treat some conditions such as hypertrophic cardiomyopathy and amyloidosis. Surgery may be done if the condition causes heart failure symptoms or a blockage that interferes with the heart's pumping action. So in this case, for hypertrophic cardiomyopathy, you may need a surgery. And in case of amyloidosis, if other treatments don't work, a stem cell transplant may be needed. And treatment for amyloidosis is available at specialized clinics. Together, you and your care team can develop a treatment plan that is best for you. Now, these are all about medical science, about the disease left ventricular hypertrophy. Now, let's talk about lifestyle and home remedies. How you should change your lifestyle, what you can do by changing your lifestyle, and home remedies. Lifestyle changes help lower blood pressure and improve heart health. You should try these healthy lifestyle changes. Number one, eat a nutritious, healthy diet. Choose fruits, vegetables, whole grains, low-fat dairy products, and good fats such as olive oil. Limit foods and beverages high in added sugars, salt, and saturated fat. Choose low sodium or no salt added foods. Don't add salt to your meals. Number two, don't smoke or use tobacco. Quitting is the best way to reduce the risk of heart disease and its complications. If you need help quitting, talk to your healthcare team. Number three, limit or avoid alcohol. Alcohol can raise blood pressure, especially if consumed in large amounts. If you choose to drink alcohol, do so in moderation. For healthy adults, that means up to 1 drink a day for women and up to 2 drinks a day for men. Number 4, exercise regularly. Regular exercise, regular physical activity helps to lower blood pressure. With your healthcare teams, aim for at least 30 minutes of physical activity most days of the week. Some sports or exercises can temporarily raise blood pressure. Talk to your healthcare team about the amount and type of exercise that's best for you. Number 5, manage stress or any kind of mental pressure. If you are overweight, manage weight. If you are overweight or if you have obesity, losing just a few pounds can help lower blood pressure. Weight loss may help reverse left ventricular hypertrophy. Talk with your healthcare team to set realistic goals for weight. Number 6, manage stress, any kind of psychological pressure. Find ways to help reduce emotional stress. Getting more exercise, practicing mindfulness, and connecting with others in support groups are some ways to reduce stress. Now, if you are already suffering from left ventricular hypertrophy, what you should do for your preparation for the appointment with your doctor. Now let's talk about preparing for your appointment. You may be referred to a doctor trained in treating heart diseases. This type of healthcare professional is called a cardiologist. What you can do? Number 1, write down your symptoms, including any that may seem unrelated to the reason you scheduled the appointment. Number 2, make a list of all your medicines, vitamins and supplements. Include the doses. Number 3, write down important medical information, including other conditions you have. Number 4, write down important personal information, including any recent life changes or stressors in your life. Number 5, write down questions to ask your healthcare team. Number 6, find out if your family has a history of heart disease. Number 7, ask someone to come with you to help you remember what the care provider says. And now you also have to have some questions to ask your doctor, and these questions will help you understand better about your disease called left ventricular hypertrophy. Question number 1, what's the most likely cause of my symptoms? Question 2, what test do I need? How do I prepare for them? Question 3, what types of treatments do I need? Question 4, should I make any lifestyle changes? Question 5, should I restrict any of my activities? Question 6, I have other health problems. How can I best manage these conditions together? Don't hesitate to ask any other questions during your appointment. Now, what you can expect from your doctor, or what to expect from your doctor during your appointment. Your healthcare professional is likely to ask you many questions. Being ready to answer them may leave time to go over items you want to spend more time on. You may be asked, number 1, what are your symptoms? Number 2, when did the symptoms start? Number 3, have your symptoms gotten worse over time? Number 4, do you have chest pain or rapid, fluttering or pounding heartbeats? Number 5, do you have dizziness or have you ever fainted? Number 6, have you had trouble breathing? Number 7, does exercise or lying down make your symptoms worse? Number 8, have you ever coughed up blood? Number 9, do you have a history of high blood pressure or rheumatic fever? Number 10, do you have a family history of heart problems? Number 11, do you smoke or did you smoke? Number 12, do you use alcohol or caffeine? So that's all about from A to Z of left ventricular hypertrophy. And if you want to know more about left ventricular hypertrophy, you can visit the websites like Mayo Clinic, like Cleveland Clinic, like John Hopkins Medical University, like Maryland School of Medicine, or you can also take help of Google. So I think this will help you understand better about your disease. And I think you did enjoy. If you want such types of educational video, you can give your comment, you can give your likes, and you can also subscribe to this channel. So wishing you all a good heart. And last thing that I always say, be positive, think positive, stay positive, and try to lead a cheerful life with activity. Wishing you all a good heart. Thank you. Bye bye.